Here we are in our English course. Those are my friends, Chloé.
Hi.
And Eva.
Hello.
My name is Hélène. We will talk to you about, in the first part, the tooth eruption, and in the second part, about the tooth anatomy. Let's Chloé talks about the tooth eruption of the primary teeth. You can go.
Thank you, Hélène. So I'm going to talk to you about primary teeth or milk teeth. This, firstly, the teeth eruption is the process when a tooth emerges from the gum and becomes visible in the mouth. The teeth of primary teeth starts to erupt at the age of 5, between the age of 5 till 10 months, and at 3 years old all the teeth will have erupted. So there are 20 teeth in a baby mouth, 8 incisors which erupt at first, 4 canines and 8 molars. So there aren't any premolars in baby mouth. The eruption time depends on children. It's earlier for girls than for boys, and it can hurt them, the children. And the teeth erupts 2 by 2, so one on each side, like permanent teeth. The child during the eruption chews on things. It's called teething, and during teething, children are restless.
That's very interesting. Now, Hélène, could you tell us more about the permanent teeth, please?
Yes. The permanent teeth goes through the gum during childhood. The first permanent teeth erupt and grow up about 6 years old, and the other teeth continue this process, which is over about 12 years old. But the rhythm teeth erupt at the age of 18, later or never. There is an English story who called the tooth fairy. The tooth fairy is in fact the parents who give a gift to their children.
Now let's speak about the second part of our work, which is tooth anatomy. First of all, we'll talk about the crown, and after that the root and the dental environment.
Yes, so sorry, for the first part of the tooth is the crown, it's the part which is visible in the mouth, and there is 3 layers in the crown: the enamel, the dentin, and the pulp. So Eva, could you describe us those 3 layers, please?
Sure. So as Chloé said, the enamel makes part of the crown. It is on the top of it. It is a white, shiny and translucent substance. It is resistant to chemical and mechanical attack. In fact, it is the hardest part of the tooth, and its main aim is to protect the tooth from the oral environment. The second layer is the dentin. The dentin is under the enamel and surrounds the dental pulp. It forms the bulk of the tooth. It is sensitive to touch and other stimuli, and on top of that, a yellowish color is the cause of a yellowing teeth. Then the third part of the crown is the dental pulp. The dental pulp is also called the nerve of the tooth. It is a very complex organ which is full of nerves and blood vessels. For the patient, pain is felt when tooth decay reaches the pulp, and on top of that, the dental pulp can die in the tooth because of cavities or other traumatism.
Yes, and the second part of the tooth is the root, which is included in the bone, and it's not, the root isn't visible in the mouth.
So the root is in the dental alveolus, and it's hidden by the gum that we can see here. It makes up 2/3 of the teeth, and it's covered by cementum. The cementum is like enamel, but on the root. It is a soft tissue and makes thin layer on the root. His main goal is to act as an attachment to the periodontal ligaments that we can see here. And to finish, the apical foramen, which is here, is a hole in the tip of the tooth where blood vessels and nerves enter the tooth.
So that's it about tooth eruption and anatomy. I hope you have found it interesting. Have a good day.
Hi.